The biggest study so far of COVID-19 patients here in the UK shows a third who've been admitted to hospital have died. Nearly 17,000 patients from 166 hospitals were a part of this study, which found the fatality rate in hospitals is of the same magnitude as Ebola. We can speak to Professor Calum Semple from Liverpool University, the chief investigator in this study. That is quite a shocking thing, isn't it? Nearly as deadly, if not as deadly, as Ebola. Why is that the case?
Well, the study is the largest in the world, certainly largest outside China. What we are looking at is those patients that are admitted to hospital. So the vast majority of people that don't come into hospital, of course, don't die of COVID. They have smaller illnesses, sore throats, snuffly noses, a bit of a nasty cough, might even have a nasty chest infection that can be managed at home. But what we did was look at those people that get admitted to hospital. And sadly, 1/3 of the people that are admitted to hospital have died within 2 weeks. And many more are receiving ongoing care, but sadly, some of them will die too. So we're looking at an overall crude hospital case fatality rate around about 1/3, possibly as high as 40%. And that is actually the same as the best care with Ebola. And what we hope to get across and hope people understand is COVID is a very serious, deadly disease. And if you're in these high-risk groups, people need to take notice, self-isolate, or in some cases, shield themselves.
Yes, it's a sober reminder, isn't it, as the pressure grows to ease the lockdown. I mean, in the simple terms, what your study tells us is that if things have advanced for people to such a stage that they need hospital treatment, then the body at that stage appears less able to deal with it effectively. Is that fair?
Well, that is fair, but it also has to be recognised that the people that are now getting into hospital are the sickest. Hospitals are quite careful not to admit anyone who really can stay at home. So the people that come into hospital tend to be those that need help with fluid or help with oxygen. And of the people that are coming in, many of them have other problems that are associated with old age, or other problems such as heart disease, lung disease. But a feature we found, which is a surprise, is that many of the people have obesity. About 6% of the people have obesity, and many of them are doing really quite badly.
Was there any suggestion in the study that hospitals have got better at this as the weeks have gone by? Because, of course, they're learning to deal with COVID-19 like the rest of us. Because I know there were fears right at the outset that maybe hospitals were putting patients on ventilators too early.
The overall case fatality rate has sat at around about 1/3 for the duration of our study. So I can't actually say that hospitals are getting better at it, but what we can see is that slightly fewer people are now being admitted to hospital, which is good news. We have seen a slight improvement in the survival of those people that go to the intensive care unit, but that may also be because of better advanced care planning, so that people who are identified as having a very low likelihood of benefiting from intensive care may not be going to intensive care. Intensive care is a place where people are supported as they're getting better from an illness. It's not a place where you want to go if it's very likely that you're going to die regardless, because you would lose the ability to say goodbye to your loved ones and you would lose the ability to communicate your needs. So the use of intensive care in this outbreak is a particularly sensitive issue.
It's a big study, 17,000 people. How does the UK compare to other countries?
We're uniquely placed in the UK thanks to the wonderful National Health Service. And one of the things that this outbreak has shown is the value of having a National Health Service. We've been able to care for people on an equitable basis. We recruit from 166 hospitals. That's every hospital in Scotland, England and Wales. Unfortunately, we've not been able to open sites in all of Northern Ireland yet, but we're moving towards that. And actually, at the time the paper was written, we had close to 17,000 cases. We've now recruited 25,000 cases, and that's one in every 3 people that's been admitted to hospital with COVID has either given consent for us to use their biological samples or we've been able to use their routine healthcare data.
And yet again, I see here in the midst of your study that men are more likely to have severe disease, and the gap between outcomes for men and women gets wider with age.
Yes, we are the weaker sex, and this is a phenomenon that's noted with many other infectious diseases from childhood through to later life. And we really don't understand why this is. But with other diseases, typically it's only a 2 or 3% disadvantage that men have, whereas in COVID, the disadvantage that men have is really quite striking. And even after you adjust for men behaving badly, as I call it, because more men tend to have problems with their weight, poorly livers, often smoke more than women. But even when you take into account the life choices that some men make, and also take into account factors of deprivation, these are the life chances. When you take everything into account, men are still doing much worse than women, and we don't know why this is.
Calum Semple, thank you very much indeed for being with us. Very interesting study. Thank you.